I'm Judy Fader, and I am running for Congress in our district, Virginia's 10th, and I am running to bring badly needed change and accountability to Washington, D.C. For 30 years, I have been a health policy expert, in large part fighting the special interests that are in the way of making health care affordable to all Americans. I am on leave as professor and dean of the Georgetown Public Policy Institute, where, as you heard from Ed, I'm teaching that next generation, and they are raring to go. They come to us ready to change the world, and what we do is give them the skills to know how. So it's a great opportunity. And I got to tell you that if one of my students had presented me with the Medicare drug plan that was enacted by Congressman Wolf, his fellow Republicans, and President Bush, if they'd presented that in one of my classes, they would have failed, as they are failing you. The design of this program makes no sense. It sets up a confusing enrollment process in which it's all but impossible to make thoughtful, informed decisions about what plan is best. It allows HMOs and other insurance companies to dictate what medicines that people can and can't take should their health care needs change. It protects drug company profits and wastes taxpayers' dollars by explicitly prohibiting the government from negotiating for the best prices on medicines. And it leaves gaps in coverage that leave many seniors unable to afford the medicine they need.
I'm on a very limited income, and in order to pay my rent, it was a toss-up. Buy my prescriptions or pay the rent. So I was getting behind in my rent, and the next thing I know, I have an eviction letter. I had to go without my medicines for 2 months, except for my anxiety medicine. And you cannot imagine how frightening that was. I had to pay out of my pocket over $400 a month for prescriptions. This didn't count the doctor's bills. My doctors have not been paid properly since February. I mean, they are trying to kill us either with paperwork or not letting us have the medical care we want.
Thank you
for letting me speak.
Thank you.
Thank you.
Thank you. I appreciate it. George?
I had a stroke in '94, April of '94. I've had a pacemaker put in '96 because I have atrial fibrillation. In '99, I was diagnosed as diabetic 2. In 2001, I had treatment, external radiation treatment for prostate cancer. When I had my stroke, I couldn't work anymore because of my right hand. The company paid me a long-term disability for 2 years, and then it ran out. I take 10 medications a day, and I try to get everything I can. I went to the Department on Aging, and they tell me, they hook me up with this patient assistance program, which is fine, because I was of the samples that I have 2 medications I can get from the doctor. I got used to get from the doctor the samples. I had 4 of the medications that are really expensive that I got through the patient assistance program. But the thing is, when they sent me my patient's assistance, they sent it to me for 4 months at a time. When they came out with this Medicare Part D, I didn't want to sign up for it either. And I signed up on the 15th of May. But then, of course, when they found out I was on that, they cut out all their patients' assistance program. The two ones, I was getting samples from the doctors, they went generic. So the doctor don't get samples anymore. This is what I've gone through. I don't have enough money with this. The donut hole comes up. I won't have enough money to buy my medications. I have a set income, and that's all I can work on. I don't see why we as seniors have to suffer for something that the government wants to pay big business, meaning the drug companies. It's not right. It's been a struggle. It still contains a struggle. I owe doctor bills. I owe hospital bills. I can't pay them. And they had talked to me. I said, yeah. I said, I'll tell you what. I'll sell my condo, pay off all my debts, and I'll have to live on the street. Well, they just kind of laugh at that. They think that's a joke. But people don't realize that's the truth. I mean, that's the thing. And I know that a lot of seniors are going through that. And I think we need somebody in there that's going to look out for us. After all, we are the backbone of the country. We've carried the country for years and years.
We are so lacking in accountability in every single aspect of policy and operation of this government. That is what this election is about. When we vote on November 7th, it really is. This is something, we talk about, it's not, consumers may not be able to hold the health insurance industry accountable in the ways we were talking about. But as voters, it is our responsibility and our duty to hold the Congress and the administration accountable for having failed us. I am running for Congress for exactly that reason, and I hope that when we all vote on November 7th, that we will elect me and lots of people like me, because the only way we can change Washington is to change the people we send there. So thank you all.